Welcome back to Anatomical Footwear Projects. Today I really want to give a deep dive to you about how to stretch and increase your ankle flexibility. Notice I didn't say calf stretch, it's a little bit too much of a simplification, and exactly why I want to educate you in this video about what you really need to be achieving when you're doing a calf stretch and how to do it well to make sure you don't compromise your foot joints. So as part of that, knowing how to do the right stretch, you need to know a little bit about foot anatomy. So I have a skeleton here, and I'll also put up somewhere on the screen here some weight-bearing CT slices of the foot anatomy so you can see a little bit more clearly what I'm talking about. But essentially when you do a calf stretch, most people are really thinking just about the muscles that are coming in and attaching onto the Achilles area. There are more muscles in your calf than just the muscles that make up the Achilles. So there's 3 muscle heads, or 2 main muscles that make up the Achilles group. So your medial and lateral gastrocnemius and your soleus, and they make up your Achilles. But deep to them, if you go back and look at one of our shorts, we have a really great Wikimedia image of the deep calf muscle group that attaches onto the back of the tibia and fibula, and they actually come down through and underneath the foot all the way through to the toes, or one of the other muscles comes and attaches into the midfoot and holds up the midfoot. So when you're doing a calf stretch, it's not just about your Achilles and the Achilles muscle group. There is another whole compartment of muscles in your calf. So let's try and get the highest value out of a calf stretch that we can, and to stop thinking about the Achilles group. So the other thing about doing a calf stretch is, if you're doing a calf stretch, you've got to be really careful about not flattening the foot too much when you're doing it. So you can increase your ankle flexibility ideally by just using your tibio-talar joint, which is one of the joints that make up the ankle complex. So the ankle is not actually just this joint in here, the tibio-talar joint. It's also the talonavicular joint, which is this joint in here, where you can see there can be a fair bit of movement through the foot, and also the joint underneath it, which is the subtalar joint, which can actually get quite a bit of upward movement as well. So to calf stretch properly, if you're really wanting to make sure you're just getting that tibio-talar joint, you've got to stack the muscle or the foot properly, so we get the right planes of muscle stretch. So we want to have the tibia, the talus and the calcaneus all stacked one on top of the other. And to do that, we have to have the foot orientated correctly. So we'll do a demo in a moment, but essentially what we don't want to be doing is having the foot turned out and the foot rolled in, because we're going to get what will look like upward movement at the ankle complex, but it's actually happening in the foot. And this is really quite detrimental if you have any midfoot issues that you're trying to manage. That could be plantar heel pain, it could be midfoot arthritis, it could just be even shin splints. But the last thing we want to do is be stretching the midfoot and not trying to orientate directly to the tibio-talar joint. So we'll do a demonstration now. Okay, so to do a calf stretch properly, we'll turn around and put our hands on the table, and you want to keep your hips parallel to the support surface in front of you. Then we'll put our right leg behind us, so we're going to stretch the right calf, and we really want to make sure that foot's facing straight ahead towards the table, not turned out towards the side. So you don't want to have it turned out that way, you want to have it facing straight ahead. Now the other thing you need to make sure you're doing with a calf stretch is you roll the arch up so that the weight is on the back corner, like the little toe side of your foot on the back side of your heel, and you're pushing down through your hip into the heel, and there is minimal weight on the forefoot. Then when you've got this weight pushing down into your heel, you bend the front knee and you lean forward until you feel the calf stretch, usually in the upper part of the calf, and you hold that for 1 to 2 minutes, or as long as the arch holding up muscles can cope. So throughout the stretch, just make sure the arch is lifted up and you're not letting it roll down. And if you can try and complete that at least in the evening before going to bed, or any time throughout the day. You can also add into this a little bit of sort of pelvic tuck and push the hip forward to get a hip flexor stretch on the calf that you're stretching, which mimics the end part of stance phase of gait where you're just about to lift the heel up and push up. So it makes sure you have hip flexor flexibility and also a bit of calf flexibility. There is the bent knee version of this, exactly the same setup where you bend the back knee down and you try and keep the heel on the ground, which can be very challenging. Our model here had ankle surgery less than 12 months ago, so this right ankle is quite challenged with trying to do a flexed knee calf stretch, but really trying to keep that arch up as best you can throughout the stretch.